Hello, my name is TaLesia Jackson. I'm an undergraduate athletic training student at the University of South Carolina, and today I will be explaining the functions and uses of nerve conduction studies. A nerve conduction study, or NCS, is a medical diagnostic test used to evaluate the function of the nerves of the peripheral nervous system and diagnose nerve damage or destruction. These peripheral nervous system nerves includes the motor and sensory nerves, which make up the nervous system, as well as connect the central nervous system to the organs, limbs, and skin. The NCS is especially helpful in localizing almost any peripheral nervous system disorder, many that we as athletic trainers and athletic training students may see in our clinical practice, such as carpal tunnel syndrome, tarsal tunnel syndrome, brachioplexopathy, and more. The NCS is also used in conjunction with an electromyography or EMG to assess muscle function. When used together, an NCS is used to observe electrical activity of a nerve, and an EMG is used to observe the electrical activity of a muscle. In preparation for the test, the patient must stay at normal body temperature. Being too cold will slow the nerve conduction. The patient must also tell a doctor before the study if they have a pacemaker or cardiac defibrillator. Now I will describe how the test is performed. When the NCS and EMG are used in conjunction, the NCS is normally used first. 2 or 3 recording electrodes are placed on the skin over nerves at different spots. A stimulating electrode or a pronged instrument with stem will produce a mild and brief electric shock to stimulate the nerve. This electric shock usually lasts about 1 millisecond. The stimulation and nerve response will appear on a monitor. The distance between electrodes and the time it takes for electrical impulses to travel between electrodes are used to measure the speed of the nerve signals. This is known as conduction velocity. Nerve conduction velocity between 50 to 60 meters per second is considered normal. A damaged nerve may send a slower and weaker signal than a healthy one. For the EMG, needles are placed in the muscle body and observed to diagnose disorders in the muscle that could be due to damaged nerves. Both techniques should be used together for a complete diagnostic study. The NCS usually takes about 15 minutes to an hour, depending on how many nerves and muscles are being tested. Well, that's all that I have for you on nerve conduction studies. Thank you for watching.